Well, the FDA could give the green light for new COVID boosters as soon as tomorrow.
Yeah, the updated shots come as confirmed cases of the virus continue to tick up across the country and here in Metro Detroit. Our Dr. Frank McGeorge is here with a look at the CDC's new approach to fighting the virus as we head into fall here, Doc.
Yeah, exactly, Kimberly and Damon. You know, safe to say we have moved away from mandates to more common sense type recommendations, but most health officials do expect COVID cases to continue climbing into the fall and winter. And the new head of the CDC wants Americans to be prepared for that.
The coronavirus pandemic was officially declared over, but of course the virus never went away.
Look, COVID is here with us. We are going to have to continue to live with it.
COVID-related hospitalizations are up 15.7% in the most recent week, and COVID deaths are up 17.6%. Both have been trending up since July, says Dr. Mandy Cohen, the new director of the Centers for Disease Control and Prevention.
So that's the first step of, well, make sure your immune system is as strong as it possibly can be.
CDC has 4 steps to fight the virus this fall, advising people to stay up to date with COVID vaccines, to improve indoor ventilation, to test yourself as needed, and to stay home when you're sick.
As long as we use these layers of tools, I think we are in a better position than we have been before.
The elderly and people with underlying health conditions may want to consider wearing a mask indoors, particularly in crowds.
I'm not talking about mandating anything. I'm talking about good common sense and following the recommendations that we likely will get from the CDC as we proceed into the fall and if the cases increase in their number.
The CDC is also encouraging Americans to get a flu shot this fall. Its new ad campaign stresses the flu vaccine can turn the flu from, quote, wild to mild.
Now, once the FDA approves the new COVID boosters, the CDC's advisory panel will meet to issue recommendations on who should get the shot. They have a meeting scheduled for next Tuesday, and the CDC director is expected to sign off on their plan soon after making the shots available.
Now, one big change this time around with these new shots is they're not free, right? You got to come out of pocket.
That is exactly right. In fact, this time around, the federal government is no longer paying for them. Now, most people with health insurance will not have to pay anything out of pocket. But if you do not have health insurance, these shots are going to probably cost around $120. Ooh. There are some plans to have some boosters available for free at community health centers for people who cannot afford that, though.
Yeah, because that's steep if you don't have health insurance. Okay.
Things have changed.